Dr. Gomez, let's talk about, let's just say a person comes in with a denture, and he had the denture for a while, and it seems to be not fitting anymore. Well, it isn't fitting anymore. Sometimes patients think that it's the denture which broke, it's the denture which kind of went bad, when really what happened is the person's mouth, bones, the arch started shrinking, and it cannot possibly fit. What options with new days, again, maybe with because of implant or kind of like half-half, like a few implants only and the denture, what can be done there these days?
Right now with implant, we can do a lot for this kind of patients that are miserable because they cannot chew properly, they cannot speak properly with unfitting dentures that is just, moving around the mouth while they're talking or while they're eating. So with implant, the least you can do is placing 2 implants, and that will make a huge difference to the patient. That patient is going to be more comfortable, he's going to be able to eat properly, the denture is going to be more stabilized, and they will not have any problem, speaking and chewing. Which is,
so what you're saying, what you're saying, Dr. Gomez, is that you place 2 implants, and on those 2 implants you screw or whatever it is you do, you put the denture on it. So the person still has a denture, but instead of it sitting on his gums and moving around, it's solid there again, maybe like the Brooklyn Bridge kind of.
Yes, yeah, that's what we do. Now we can place 2 implants, and there's some attachment that goes on inside the dentures. That once they put it on the implant, it's going to snap on the dentures, and that will make the denture to fit more, properly, and they will not move around, and the patient will be able to eat better.
Well, that must be a huge difference in terms of, because I've never had denture, but thanks God, but like that feeling of moving around and all that. And also, let me ask you, once you do this denture with this new implant way that you put 2 or more implants and put the denture on it, will it eventually still get out of place and not fitting, or at that moment, no, it's going to stay that way for basically ever, more or less?
Well, yes, it will stay for a long time. Some dentures, they might need a little adjustment because the attachment that we're putting on top of the implants, sometimes the little ring that goes inside that makes the denture to fit strong, it gets a little loose, so there has to be some adjustment. But that's not like replacing the whole denture or replacing the implants. It's not like making a new denture, just an adjustment that the patient might need in the future, but that's not costly at all.
Interesting. So since you mentioned doesn't have to replace the denture, let me ask you, that person comes in, his denture doesn't fit anymore, you suggest to him and you diagnose that he could be getting a couple implants and put the denture on there and do that, basically new way of wonderfully doing a denture. Would the person have to get a brand new denture all the time, or can sometimes be his old denture be used for that procedure also?
Oh no, depends on how old the denture is. If the denture is too old, it's all worn down, then the patient might need a new denture. But if the denture was done recently, you have to reevaluate the case and make sure that that denture is okay to receive implants attachment in it. Sometimes patients just get a new denture from another dentist and they come in, and you don't want the patient to pay again for new dentures. If the denture was made correctly, because
right.
The denture could be okay, but the problem is the patient doesn't have enough bone to support the denture, and even with a lot of bone, sometimes the denture, most of the time the denture doesn't stay stable. They need some kind of retention from somewhere, and the bone is not enough. So when you place the implants and you place the attachment, you can probably use the denture if the denture is new.
All right.
You don't really have to redo a new denture.
Good. So there are sometimes, sometimes in many cases the way I hear you, it can be used. Sometimes it is kind of like broken and stuff, and it's better to get a new one.
Exactly.
Wonderful.
Yes.
Wonderful. Well, it's great to have to see constantly that new technology, does not bypass dentistry either. Great. Thank you.